Hello, everyone. Welcome to another exciting edition of the Revenue and Healthcare Innovation Series. I'm Dan Murdoch, your humble host, and boy, do we have an awesome guest lined up today. Please allow me to introduce Dr. Stephen Silverstein, founder of Silverstein Eye Centers, an esteemed and well-respected full-service eye care practice located in Kansas City. And if that wasn't impressive enough, he's been recognized as one of the best cataract surgeons in America. Welcome to the program, Stephen.
Thank you. It's truly a delight to be here with you.
Absolutely. So it's customary that we kick off by asking you to share a little bit about yourself, in particular, your history as a provider in healthcare and your leadership at your practice today.
Thank you. I did my initial training in Boston in the mid to late 80s, and then went on to do my corneal transplant fellowship at the University of Michigan at the Kellogg Eye Center in Ann Arbor. And I've been now in private practice and academic faculty in Kansas City for 32 years. Just getting warmed up. Have developed a wonderful practice, not in any way because of me, but because of just an absolute incredible staff, administration, front desk, technicians, nurses, etc., and built the surgery center and a large research department as well. So have been involved in clinical research my entire career, having been either the principal investigator or medical monitor in over 130 clinical trials to date. But it also gives me the opportunity to scratch my academic itch by working with the medical students and the residents who do 1-month block rotations with me. I teach them in the classroom. I lecture nationally and internationally in all facets of pharma, surgical device, and diagnostics. That gives me a great opportunity to publish and to consult with industry. So I really have a very diversified and robust career with large clinic and surgical volume, mixed with all facets of consulting and education, which I love. I do a lot of publishing and, as I mentioned, speaking. So it really is just a remarkably fulfilling career. Couldn't imagine being happier in anything else or doing it anywhere else.
That's incredible. And it's like a Michelangelo of sorts with respect to all the different things that you've been able to experience, both on the academic side and, of course, as a top class provider. I would love to double click into what it takes to run a successful practice, right? It comes with its fair share of ups and downs. In your opinion, what are some of the most challenging aspects a single or multi-specialty provider should be either addressing or thinking about addressing in 2023 and beyond?
There are two well-known issues that plague any practice, or for that matter, any business, but especially medical practices, no matter how big or how small. And I have been in a practice with as few as 2 of us and as large as 30 of us, with a staff of 350, 9 locations, 3 surgery centers, and a central business office. So I've seen the gamut of size, and yet that doesn't in any way improve the areas that we stumble upon. Number one, of course, is HR. No matter what business you're in, HR is always the biggest bugaboo of business. And having people who are adept at handling issues of staffing, and I'm talking from the front desk secretaries to fellowship-trained physicians, all of us seem to have behavior problems. So HR is always the nemesis of any business. But specific to healthcare and medicine, as you know, we don't get any training or background in this whatsoever in medical school or beyond. It's not well known, but a lot of the reasons why doctors will go to or migrate to an academic center or work for a hospital-owned practice or a large group, for example, like Kaiser, is because they really don't either want to invest themselves in the education of the business of medicine and healthcare, or because it's frightening to them. And that's totally understandable, because you can be a dynamo physician and surgeon. But if your business acumen or if your business staff are unable, the business is destined for either failure or mediocrity. And there's no reason for that in 2023. We have the tools, and more important, we have the consulting help to make those issues all but disappear. I think that one of my senior partners way back, and if you're any caliber of physician, you have to know that we are standing on the shoulders of giants who come before us. And I would soak up like a sponge anything my predecessors and mentors taught me way back when. And one of the most important was to surround yourself. Don't worry about the cost. Surround yourself by the best in what they do so that you can be the best at what you do. And so I have a satellite of remarkable consultants in legal and in finance and in marketing and in IT, all of whom are on retainer that I can call anytime, day or night, to help work through issues that may be very time sensitive. And so rule one, for sure, work with people who are leaders in their respective fields of expertise so that you can work together as the physician and business side to put together an incredible office environment and financial package for you to practice.
It's very sage advice, and I'm a believer of that as well. Surround yourself with people that are smarter than you in all of the areas that you might not be best in class at. We could all follow that advice. There's no doubt about that. As you look back in your career, what would you point to being as a critical decision you made that allow you to truly and successfully scale and grow your practice? Is there a particular decision that you made that you felt really catapulted your ability to do that?
I've been thinking about that, and without question, this is one of those situations that my failure was what taught me how to ultimately succeed and to thrive. I alluded to the fact that at one time I was part of a very large ophthalmic practice. It at the time was the largest practice in the country. And we were the anchor in the mid 90s for a practice management company, or what was called a PPMC back then. And the goal, as we've talked about, was to let them do what they do best so that we can be in charge of the healthcare delivery and do what we do best. It didn't work out that way for several reasons. Number one, they bought all assets of the practice, and in exchange for the promise of stock that never went anywhere. Number two, the whole space of practice management companies collapsed when Wall Street realized that there was very poor infrastructure and no modeling for same-store growth. All of their incredible numbers were through acquisition only. And when Wall Street became savvy to that, it punished the space severely, to the point where all practice management companies of its day disappeared. That really taught us significant lessons, we being the physicians who were now out and back at it alone, but now with millions lost in revenue over the years we were with them. But yet the lessons learned in IT, in business skill set, in marketing, in economies of scale was invaluable. I can't imagine that an MBA in healthcare would give anything close to the real world experience that all of us suffered through. And it really was a very painful journey. Some of the doctors retired earlier than they would have otherwise wanted. Other doctors broke off and went to sit out their non-compete, while the rest of us were trying to piece this together and put out the fire. But what it taught me was just incredible, because then set on my own, without the burden and bulk of a large group, and because the whole group unwound, I was able to fly and soar. And within the first year, built a surgery center, built optical, brought in other doctors, built another location, taking all the things that I learned. So bottom line is, your incredibly insightful question. It was my failure that ultimately led to my greatest success.
It's incredible. And we often say it's just as good to know what it shouldn't look like as it is to know what it should look like. And I think that's the essence of your statement. You learn through your failures, and you ultimately are able to catapult yourself to the next stage of your career, and be better for it. I'm going to transition a bit here. This is a fairly obvious statement, right? The patient experience is a provider's North Star. However, the guiding principles are much broader than that, right? And as you spoke earlier about what are the ingredients to your success, you spoke about your employees, you spoke about your partners. How do you strike a balance in prioritizing the experience of everyone, right? So not only patients, but also your employees and those partners. I would love to hear your thoughts on that.
Very, very insightful question. First and most important, you have to have complete unanimous buy-in by the entire team, which means that you have to maintain excellent communication at all levels. The physicians with the administrator with middle management, and middle management department by department, with all of the staff. And then you all have to get together for semi-regular meetings and social events. Here we are in the summer of 23, so in another 3 weeks, having a pool party and barbecue at my house for the entire staff and all of their families. So buy-in by the staff as far as the vision and the philosophy of the principles of the practice is paramount. Because if you have people who don't agree, or who deviate from the priorities and the philosophy of the practice, then it not only is a morale buster, but it's felt all the way at the patient level as well. If you are interviewing new staff, I tell them every single time that I have two priorities. I want this to be the very best practice that a person can seek eye care, so that the patients and their families ask, why would I go anywhere else? I want the patients to hear the phone operators answer with a smile, to say, wow, these people are happy there. This seems to be the place I should be, because that's the first impression of your business or your practice. And those same people are often the last people that the patients are checking out with. So those two touch points are paramount. I tell my staff that I have two equal priorities. One is to give the patients the very best experience from beginning to end, and to make sure that their healthcare is delivered in such a way that they know that they're in a place of competence, a place of integrity, and a place of empathy. Number two, and equal of importance to me, is how the staff is treated. I want the staff to know that while we're a big organization, we really run as a big family, and that every door is always open to conversation, and anything that the staff needs. I want to make sure that they know that I have their best interests at heart. And I think that's what has led to such great employee retainership, even and including during COVID. During COVID, I was one of only two practices in Kansas City that did not shut down. We were open full time. And although we weren't allowed to do elective surgery, we still did transplants, retinal procedures, glaucoma procedures, and saw about 45% of our normal volume. But I sat the whole practice and staff down and said, I'm not going to ask anything of you that I'm not exposing myself to as well, but I want to teach you about immunology and infectious disease and virology, and help you understand that you're going to be just fine through this. Don't listen to the media, and even worse, don't listen to the politicians about the science of COVID. Let's talk about what this really is. and you're going to wind up being just fine. You can see that staff members in all the other practices are being furloughed or laid off or fired, or practices closing as a result. I'm promising you full wages and full benefits so that your family will be safe and taken care of during this time. Just hang in there. So again, another example of communication and practice-wide buy-in so that everyone's on the same page. And they were so grateful that we did that and met periodically to talk about this. So bottom line is making sure that your staff knows that they are the priority to you, much more important than I am to them. The practice success is not based on me. I'm just the bill payer, the guy with the name on the door. They're the ones who people come back to ask for. Hey, can I have that nurse that I was with last time, or that technician? So, and for years and years, I had a group of several retired women who all shared one full-time paid position, and they would organize themselves as patient advocates, so that they would greet people when they came into the practice. They'd help them fill out forms. They would check on their place in line. They would show them to the restroom. They would go around and offer them coffee and hot chocolate and cookies. I said, your only job description is that I want this waiting room to feel like you're throwing a party in your living room every day. I want patients to feel that level of comfort. So these are examples of the patient experience, the staff experience, that lead to stability, longevity of staff with minimal turnover. And it goes without saying that when patients have that level of experience and a good to great medical and surgical outcome, they're obviously going to tell friends and family. So word of mouth is always our most important source of new patients. So we see, over, 250 new patients a month in the practice. And again, it's not anything to do with my accolades. It has everything to do with the staff and, as you point out, the patient experience.
Such an incredible answer and an amazing anecdotes. I think the answer that I'm taking away is that they're interrelated, right? It's not one without the other. In fact, if you build a great employee experience, you have a shot at creating a great patient experience, which will lead to all the other amazing outcomes associated with creating sustainability in your practice. So that's incredible. Thank you for sharing that. Now we're going to turn the tide here to talk a little bit more about the macro and micro challenges in healthcare. There are a lot of headlines out there around economic instability and posting losses, and a lot of the things that would say that the tide is turning, not necessarily in the direction of a lot of providers at this moment in time. What do you think is the best path forward in creating stability for those practices? Is it about focusing on the employee experience so that you can address that supply chain of a patient experience that's exceptional, or do you think it's something else?
Before you expect or solicit patients to your practice, you have to have your base of operations, your foundation, your infrastructure sound. You've got to know, first of all, what your guiding principles are that govern the practice, and you've got to make sure that everyone else in the practice is aware and follows those tenets. You have to make sure that the business model is not just appropriate for today, but fluid and flexible for tomorrow. As you know, some of the biggest practices in medicine, and some of the biggest businesses have failed and are now just part of the history books because they weren't adaptive and they were not reading the tea leaves to see what the changes were coming down the pike. Take Blockbuster. I mean, everyone has rented movies from Blockbuster. Now there is no Blockbuster. Netflix, on the other hand, has done an amazing job going from a hard asset product to mail to a streaming service. So they moved forward with the changing times. Analogous to this in healthcare, we have to be ready to shift without compromising patient quality or the patient experience. So how do you shift? Number one, you have to have technology that's working for you, that you're not enslaved to. Your EMR, electronic medical record system, has to work smoothly in concert with your PM, your practice management system. And if they're not communicating well together and generating legitimate reports that help guide you, then it's time to seek another system. Not meaning to sound like a billboard, but years ago when we were evaluating electronic medical records, or sometimes known as electronic health records, we interviewed 6 companies. We had them do their roadshow with us and take us through their navigation. And we chose to work with IMD, EYE-MD. They don't even know I'm telling you this. This isn't any type of solicitation whatsoever, and I don't work with them or for them. I'm a happy paying customer. But now 10, 12 years later, I still couldn't be happier with them, wouldn't change anything. But we have upgraded and updated our PM, our practice management base, to stay current and avant-garde. Number 2, you have to have people who have their finger on the pulse of the change in not only rules and regulations, but also how people access their healthcare information. The day of the yellow pages is gone, but back when I first started, that was everything. Now you do have a small presence on yellow pages electronically, but patients are much more savvy. They're looking, at ratings, they're looking at Google, they're looking at other forms of information to learn and decide what practice and what practitioners they want to work with outside of and in addition to word of mouth. So you need to work with people who are really good at optimization of your website, of keeping your website clean and fresh and up to date, with new and relevant information, not just talk and comments for talk and comments sake, but with really good information that will be a leader to helping a patient make a decision of which practice is right for them and which practice is best for their family. Similarly, you need to work with a company who understands about revenue collections management and billing and collections, because again, you could be seeing so many patients and doing so many surgeries or whatever your field is. But if it's not being billed out in a timely fashion, if a claim gets kicked back and it isn't scrubbed and refiled in a timely fashion, then aged accounts receivable skyrocket, and that, of course, is going to wreak havoc with the normal overhead and expenditures that you have to run the practice, let alone save to build and to grow and to stay current and modern, which is another super important aspect, especially for us in ophthalmology. So much is tech driven, from our lasers and our diagnostic machines to what we use in surgery. So staying cutting edge and avant-garde in tech and knowing what you really do need to update and upgrade versus products that are whizzed beside you that look fancy and exciting, but really aren't going to help move the needle in your practice. Looking for new sources of revenue stream so that you can understand how to minimally impact overhead, but increase revenue in ancillary ways, such as new diagnostic tests. I mean, you can easily do the return on investment, the ROI of a diagnostic test. If you're in internal medicine, you might think about putting in hearing services into your practice. As basic cardiac monitoring, such as an echo or treadmill. You're not going to bring in nuclear to a standard internal medicine practice, but there are many, many examples of ancillary things. Bringing a lab in can be huge. And in the case of ophthalmology, having access to an ownership in your own surgery center is paramount. Because remember, the single most important thing any of us have is our time. Whether you're using it for productivity or whether you're using it for work-life balance, which looks different at different stages of your career, different stages of your family, different stages of your life. Being able to regulate and have control and discipline of your time and time management is in large part due to how smoothly all these other components go. So if you're working with a phenomenal company to help you with revenue collections management and to help you with IT and to help you with website optimization and design, to help you with staying current with technology. All of these things will serve you no matter how big or how small you are. You don't need to be the biggest fish in your marketplace to be the most successful fish.
That makes complete sense. And I think if I'm trying to summarize that, it's digital innovation and diversification, right? If you keep those two
Brilliant.
things front of mind, you have a really good shot at creating sustainability and being on the cutting edge of your particular specialty or practice type. And so I'd love to double click on one of the things that you mentioned, which is so critical and obviously near and dear to our hearts, which is revenue cycle management, which is probably one of the more common operational sore spots that a healthcare provider experiences. You were making mention to some of the common challenges that a lot of providers experience relative to revenue being outstanding in AR for extended periods of time, or denial management, and all the steps that are associated with a healthy revenue cycle management process. What sort of innovation do you think is required here? And is it a technological one, as you were mentioning before? And do you have a perspective on the role that Adonis plays in this innovation equation?
Your question about how much of this is tech driven, is this principally a tech issue now, really gives me pause. What I realize is the tech side is not going to drive out the human element in this. Yes, you need to have the technology that's instant. You need to be able to file data, file numbers, and know exactly where you stand at any snapshot point in time, whether it's daily, weekly, monthly, or looking at trends, which is critically important to understanding where you are succeeding and where you are not. But the human element and the people who understand how to drive that technology will always be paramount. And if there's one thing I've learned in my relationship with Adonis, the people that they have behind the tech is honestly the wisest group of people with whom I've ever interfaced, including back in the day when we were with the practice management company. That's what they were all about. But the ability to understand metrics and benchmarks, the ability to see not only how you're doing measured against other like-sized practices, but also to take a deeper dive and understand how you are what is your percentage of collections based on your billing. Are you billing enough per CPT code? Are you billing too much? But most of the time, in order to not do something wrong, we as physicians frequently underbill, undercollect. And that's been pointed out to me over the years as I have been in my learning curve. So what Adonis brings to the table is not only instant numbers at any point that you want to evaluate, and numbers that are truly going to lead to positive behavior modification. And that really is key. It's not just looking at numbers, it's what do those numbers do? What do they teach you so that it can behavior modify us? And that is where Adonis has really been shining brightly. Their ability to look at not just your percentage of insurance collections, but for example, how are you doing with the Blues? How are you doing with Cigna, United? How are you doing with your Medicare collections? How are you doing compared to 6 months ago or a year ago? Are you up? Are you down? Why has that insurance company dipped 10%? And what does that look like as far as reasoning? Is it something we're doing on our end? Is it a change in the demographics of where the insured are coming from, what's happening in your region of the country, because this is not a one-size-fits-all business. The country is divided up into 5 payer regions, and having people who are expert within each region, within each specialty and subspecialty within each region, that's not something the normal provider can do for him or herself. And it's not even necessarily something that a consultant is able to do because we're all in our bubble. For example, we in Kansas City know what's going on in our city. But how do I or my regional consultants know how that really looks as far as what we could be doing, what we should be doing? They help keep us on the path of making sure we don't do something accidentally incorrectly that could get us into regulatory or legal problems. They help review the numbers, and these consultants that we are surrounded by can really help look at short-term trends. But putting that all together with the type of sophisticated computer power, and more important, the interpretation of that data by the people who are directing that computer power, that is what Adonis stands alone in, truly.
It's amazing. And actions that can be informed by insights that drive better outcomes is certainly what we want to put everybody in a position to lead the best revenue cycle management practice, to lead to better patient experiences and clinical outcomes, right? And I think, again, all the it's not, the answer isn't just one thing, it's all of these things, and they can be made possible if the right steps are taken and if the right perspective is embraced. And so,
The key is
Stephen,
you will see your practice thrive. It's not just lip service. I mean, you will see the change in numbers over time. That's what really matters. As my consultant in Kansas City, who I trust dearly and has been with me for 30 of my 32 years in practice, told me, and probably the thing that hooked me when he was soliciting our practice business. He said, as a consultant, if I am not bringing in value that either saves you enough money or earns you enough money based on my leadership and direction, as your consultant, my advice to you would be to fire me. And sure enough, year after year, decade after decade, he has demonstrably brought in new ideas, new methodologies, or reeled us back in when we needed it the most, to really earn his keep. And on an exponential scale, that's Adonis.
thank you so much, Stephen. And we cannot thank you enough for participating in this series episode. It's been an absolute pleasure. We are so proud to be able to produce this and share this amongst your peer group and all of healthcare. And if you'd like to get in touch with Stephen or with us, feel free to either email us at marketing@adonis.io or visit adonis.io. Thank you so much.
Thank you. It's really an honor. Thank you.